Hi, I'm Gilly Bond, a specialist pelvic health physio, and I'm answering your questions about bladder pain syndrome. The question I'm answering today is, what can physio do for me? Fantastic question. Loads. Physio can do loads and loads and loads. We know that we have issues with our bladder region and our pelvic floor. We also in bladder pain syndrome. We also know that we have issues with the centralized processes, the software of how our body deals with that area. And what physios are really good at doing is working with the physical and also with the software. So from a physio point of view, there's loads that we can do. And actually it's been significantly proven with 8 RCTs, 8 randomized controlled trials that I can think of, and a lot of extra work, that physio input into your bladder pain syndrome symptoms is key if you want to make progress. So I would definitely be seeing your doctor if you've got any symptoms of bladder pain syndrome straight away, but then I'd also be asking for referral to a physio. And we work very closely with our medical teams. There are loads of medications and other things that can help with bladder pain syndrome, but there's also a significant amount of stuff that physio does which will really help to bring you change. So to begin with, dealing with that region, we want to be looking at optimizing the bladder. There's loads of reasons why the bladder, what the fluid that you're drinking, not just the type, but the amount, how often you're going to the toilet, and what kind of technique you're using to have a wee, is something that we can change. And those are things that can really heighten the symptoms. So if we change them, we can start to just gently chip away at some of those pains. From a pelvic floor point of view, this is our bread and butter. We know significantly, and I did some of this research, that if we affect change in the pelvic floor, so if we can make it calmer, happier, less painful, then your bladder symptoms of urgency and frequency will significantly reduce. Now, we have consistent evidence in the literature that's available that round about 6 weeks of treatment should get you somewhere between 40 and 60% change. And the average is about 56% change, actually. But that's based on research, and research is not in life, and other things happen and life happens. So it can't always be specific, and we can't give you a certain specific change. But from a physio point of view and perspective, we would be looking for significant change in your symptoms in about 6 weeks of treatment, and that's about once a week. Doesn't mean you have to see a physio once a week for 6 weeks. You can do this yourself, but we're looking for around about 50% improvement and more, or significant change in a short period of time by working with your pelvic floor. So we, as physios, would be providing myofascial release, trying to calm that pelvic floor down. We would also be calming down and desensitizing any other areas. So if you're a male, if you've got chronic prostatitis, this also applies to you. We might be calming down the superficial pelvic floor in the female vulva as well, using gentle techniques. Physio should never hurt. So if anyone ever hurts you, if it's painful to have treatment, don't stick with it. Chat to them and say, that hurt. It shouldn't hurt. It should not be a grinning and bearing it process. All treatments should be sub-threat. So we're really good at managing our bladder. We're really good at managing the pelvic floor. The bowels and any other organs that you have inside, hopefully the kind of similar ones that we should all have if we're a man or a woman, optimizing those organs as well can really help with the symptoms, specifically constipation. We know that your bowel and your bladder and your pelvic floor share a lot of the nerves, but also the way that the brain processes information from downstairs is shared and can become blurry. So if you have constipation and you're really struggling with emptying your bowels because you're on a lot of pain relief because of your pain, then you working with a physio to optimize how you go to the toilet, actual mechanism of having a poo, what position you're in, how you breathe through it, how to push, how not to push, but also what kind of things you're eating to try and improve your bowel movement, or do we need to work with a doctor to improve the softness of your stool. All of those things can then significantly change how much your bladder hurts, because no longer will you have signals going off that back in the day would have been, oh, my bowel's really stretched with a big poo, and it now becomes there's information coming in, that's probably my bladder, there's bears eating my bladder, and then you get bladder pain. I mean, hopefully your brain doesn't look or sound like that, but it might. I'm paraphrasing your brain. So optimizing all of your organs can really help. But then also physios are very, very good at grading your exposure to things that have hurt. So we're really good at getting you back into function. And that doesn't mean making you do it. It means working with you to find ways to move that don't hurt, to sit that don't hurt, to do whatever you need to do. And, you know, sex is a normal functional activity. So we're also really good at grading exposure to intimacy. I wouldn't ever be embarrassed to talk about it. We talk about it all day, every day, and it's like talking about making a sandwich. It's really simple stuff to us, but we understand that it can be incredibly emotional and embarrassing for you. Just know that we've heard everything before, and we will absolutely keep your secrets. Everything in pelvic health physio is utterly confidential. We always work in rooms with doors. So we're really good at getting you back to things, and that's important because what we do is we change the brain's perception of what's going on downstairs. So if we get you doing more, but in a way that feels good and that it isn't painful, you know, going back to your sport, to the gym, to cycling, whatever it is, we can calm down how your brain feels about downstairs, that it's not so threatened and there aren't that many bears fighting you anymore. So in a nutshell, there is masses that physio can do, and I haven't even mentioned all of the other things. We use tools, we have devices. If you've got incontinence, we can strengthen you. If you've got urgency, we can bladder drill and train you. We have acupuncture, some of us, which can help with pain relief. We have loads of things that we do, but the key is that we should be working in collaboration with you to work towards your goals and achieving whatever you want to do. And it's not about your physio. Your physio is there as a facilitator. What they do to you, you should be able to repeat at home. None of this is rocket science. Yeah, we're all normal people that have just done degrees. So it's not rocket science. The stuff that we do in clinic, pelvic floor release, everything, you should then be able to go home and do it for yourself and keep it going. And you'll find that it's more effective if you do it to yourself than when your physio does. Little tip there. So yeah, in a nutshell, physio can do loads of things, but we have very good, strong evidence, specifically in bladder pain syndrome, that working with a physio alongside your medical teams and your nurses and everyone else is a significant thing to do. So much so that it's written into all national guidances that I'm aware of internationally, that physiotherapy should be a key first-line treatment. It isn't first line in all places, but it should be. But there are certainly moves afoot internationally to try and make it the first line treatment for pain states. Okay, so I hope that's helped, and if you've got any more questions, please put them underneath the video. Get hold of me on Facebook, on Instagram. I'm everywhere, and it's been nice talking to you. Hi, while I've got you here for a second, if you're a physio or a physical therapist interested in learning more about what I'm talking about, how we holistically manage someone in pelvic pain with a much better idea of how to apply the best of pain science in the clinic, then my Happy Bladder course, which is based on bladder pain but is really much more of a holistic view of how we treat all pain states in the pelvis. I'm working really hard to get that up online for everyone, hopefully early 2020, so the beginning of next year. So check back on the website, keep your eyes peeled on my social media, and if you're interested, the course should be going live early next year. Thanks.